There's no single focus that applies to all of our patients. One of the important things in a brain injury program is having the flexibility to address the patient's needs, which may vary widely from patient to patient and even at different stages in the recovery. So we may have to shift what the focus is even during the course of their rehab. When patients come for inpatient rehabilitation, I really think of that as a step in the recovery process. We're trying to get them from a certain stage and get them to the next stage. We are experts in the field of brain injury rehabilitation, and we draw patients from a wide geographic area. And when patients come in, we meet with the team and with the family, and we set expectations for how someone is going to do. Sometimes people do even far beyond what we might have expected when they come in. We have a brain injury unit which is 41 beds. It's devoted entirely to the care of patients who've had brain injuries. One area on the unit where some of the more severely injured patients go initially is kind of an ICU-like setting, which has windows and the nurses can look directly in, and many of our patients have multiple complications. They may have had multiple trauma with multiple fractures, orthopedic injuries, facial fractures, tracheotomies, feeding tubes. Other neurological complications can include seizures and hydrocephalus. So we really treat a very diverse group of patients. Even when patients progress beyond needing the intensive monitoring suite, they still need very close care, and we're able to provide this in all the different parts of our unit. We have a therapy gym situated actually on the brain injury floor, and this has really been very helpful. It facilitates communication between all the different therapists and nursing and all the different members of the staff. It also means that the patients don't have to go any significant distance to get their therapy. They're right there. We have an observation room which has been very helpful for those patients who have behavioral difficulties. It gives us a good way to provide supervision, and also I think family members find that it allows patients to take on a lot of activities they otherwise perhaps wouldn't be doing, and it also allows them to do it in a safe and in a supervised environment. The independent living space provides a great opportunity for family members to get a dry run of what it will be like taking care of their family member at home and preparing them with all the different aspects of that care. Brain injury patients are remarkable in that they can have extremely severe injuries and still make a remarkable recovery. So it's not unusual for us to have a patient who comes in who's maybe not even responding at all or following simple commands and going home with their family at discharge. There are a lot of reasons to come to Bryn Mawr Rehab, but I think of all of them, at the end of the day, the one that impresses me most is the amazingly caring staff that we're lucky to have here, and that can make a tremendous difference in the recovery process.